Yeah, so as Shelley said, my name is Lynsey Moorehouse. So I am the Regional Operations Manager for our PWS services here in Ireland with Resilience Healthcare. And I'm also the caregiver delegate then for Ireland as well. And I suppose when Shelley asked me to talk today about cultural diversity in PWS, I thought it was a great opportunity to share, I suppose, what we've done as a company because we found, particularly after COVID, that we had huge staffing shortages across the board, not just in our PWS services, but in all of our residential services. And, fighting for staff and trying to encourage staff to come and work with us was definitely a challenge at that time. So we didn't want it to impact the care that we were providing. So we decided as a company, we were going to have to look outside the box to see, well, what can we do to make a change, and what can we do to continue to provide and develop our services. So I'll go through the presentation. I'll talk to you a little bit about what we did, and I'm more than happy to answer any questions then, either throughout the presentation or at the end, whatever suits, there's no problem. So I'll start by just telling you a little bit about Resilience Healthcare. Resilience is part of a company called Broadlake, and Broadlake's an international group of 8 businesses that employ over 4,000 people in a variety of industries across lots of different fields, but they do include healthcare and healthcare recruitment, which was very helpful for us. Resilience Healthcare is an Irish-owned essential disability service provider, and it was founded back in 2011. And since 2011, we have seen absolutely huge growth in our residential and outreach services. Through the provision of residential, day and community-based services, we support over 300 people with autism, intellectual, physical and sensory disabilities, and of course, people with Prader-Willi syndrome. We currently provide services for a total of 40 people who have PWS through our residential, respite and outreach services. And I suppose just to give you an indication, when I started with the company 5.5 years ago, we opened our first residential service for people who have Prader-Willi syndrome. So at the end of 2019, we were supporting 2 individuals, and now 5.5 years later, we're supporting 40 individuals and their families, which was amazing. And we couldn't actually support that growth without embracing that cultural diversity and that overseas piece that I'm going to talk about with you today. So Broadlake as a company had put in place a 3x, 10x strategy, and that was their growth plan. So what they were wanting to see was 3 times the growth in terms of the services we were providing, and they were wanting us to have 10 times the impact on the world around us. And, so it was really good while the company were wanting to have all this growth, which obviously most companies are going to try and promote growth. But they also recognized that they needed to have pillars to underpin that. So they introduced the have pillars, and I'm not going to go through all 4 with you today, but the one I wanted to focus on is the highlighted one here, which was accessibility for everyone. And what Resilience and Broadlake meant by that was not just accessibility in terms of the individuals that we were supporting and their access to community and opportunities, but also to promote an inclusive environment for our diverse employees and potential future employees. So that was something that was put in place, back before COVID ever hit. It was something that the company were very much involved in, very much wanted to encourage across all of their businesses. So it's something that's embedded in our culture already, which was really good, considering the steps that we had to take. So I suppose in terms then, we had our pillars and we had our strategic plan for growth, but what problems were we going to be faced with in trying to achieve this growth? And the first thing there you can see was the required for a skilled workforce. Now, if I'm to speak particularly just in relation to PWS services, which is what we're here today to chat about, specialised care demands staff with specific training and competencies. So, recruitment focused on skill, will and fit. And what I mean by that is it's very rare for us to come across individuals who have experience with PWS. It's literally like hitting the jackpot if you interview somebody and they tell you that they've worked with somebody with Prader-Willi syndrome. But what we're looking for is, what is their background? Where have they worked? Have they had, you know, experience with individuals who have an intellectual disability? Have they had experience supporting somebody who may have complex needs? Have they had experience supporting somebody who has, you know, behaviours that challenge or behaviours of concern? Are they willing to learn? Are they interested in the area of Prader-Willi syndrome? Have they done a little bit of research? So when I'm looking for that specialised staff force, that's what I'm looking for. Are they the right fit for our service and for our individuals? Our next challenge then, as I mentioned earlier, was the post-COVID nationwide domestic shortage of care workers. We just couldn't get staff. I think after COVID, everybody was just a little bit burnt out, and people were thinking, well, there's probably an easier way for me to make a living than working in the care setting. And then there was the increased competition for qualified staff across sectors as well. High staff turnover then was an issue. When you're working in the area of complex conditions, emotional demands can be quite high on the team, which can lead to burnout. And then teams require strong retention strategies and staff wellbeing support. So it's really important to have a really good, positive environment for staff to work in, and a supportive environment for staff to work in. Because we would have also found that when we had those staff shortages, a lot of the existing staff were taking on extra shifts, and then that was also then contributing to burnout for the existing staff. So what we did was everybody put their heads together to try and come up with a solution to this ongoing problem that we were having. And we have another branch of the business where nurses were coming into Ireland from different countries and working with resilience. And that prompted us to reach out to one of our sister companies, MMA Recruitment, to see would this work for support workers, for care workers. So we reached out to MMA Healthcare Recruitment and started to discuss the requirements that we were going to have. And it was decided that we were going to commence a recruitment campaign in South Africa. So members of our senior leadership team travelled over to South Africa to meet with the recruitment team and to start building relationships with MMA, and to meet individuals as well that were interested in coming over to Ireland. So it was essential, as I said, that the fit was right. So potential employees had to hold a qualification that was similar to what was required from our domestic candidates, which would be a QQI HIPAA level 5. So they were able to go over there and meet with the team over in MMA and go through exactly what qualifications our staff over here have, so that we could find something that was similar over in South Africa. To ensure smooth communication for our residents, candidates had to be able to speak fluent English, because we felt otherwise it just would be a very difficult challenge to overcome. So that was one of our requirements. And then the process is then, hold on 1 second, Neil. Yeah. So what did we do then? So the process is agreed between Resilience Healthcare, Recruitment and HR. So the skill set and qualifications required, as I said, was something. So we had to verify that the applicants met our regulatory and clinical competency standards, and identify any additional training or certification alignment that we would have had to complete once they came over to us in Ireland. The interview process, we did that in 2 ways. So we did, some of our interviews were done in teams by our managers here in Ireland. And then when the senior leadership team went over, they did in-person interviews over there as well, which was really good. And they got a really good feel for the people that they were interviewing. So it either was virtual or face-to-face, but we had to ensure consistencies across locations and formats. So we did have a structured routine process there, regardless of the method. Visa applications then, so we had to support the requirement for sponsorship, compliance and processing timelines, and collaborate closely with HR and immigration services. Accommodation then, so while MMA sourced accommodation for the individuals coming across, the management team here on the ground would have gone out to view different accommodations to make sure that the accommodations that they were coming over to were suitable and close enough to their new work environment. And then obviously organising flights and airport transfers, and providing arrival orientation and local area guidance once they got here. So you can just see it was a huge process to kind of get this off the ground. We we felt then, so I suppose we were looking then, right, so we have all these individuals who are going to be coming over and working in our services. What do we need to put in place to support them when we get there? So we adapted our induction package. So this was to include the area orientation. So staff went with them around the town, showed them where all the shops where were the banks, you know, where could they, like, where were the social clubs, you know, was there a particular thing that, like, did they want to know where the gym was, where the pool, just general information when you move to a new area, a new country, just somebody there that you can link in with to help you to navigate your new surroundings. And extra time then was provided to support acclimatization and reduce that initial feeling of feeling overwhelmed, because I think if I had to move to the other side of the world, I'd find it extremely difficult. So, I mean, we were very, I suppose, we were very aware that these individuals were coming over, leaving their families behind, and we tried to make that as smooth a process for them as we could. We then, as part of the induction package, had a comprehensive training schedule put in place. So full access to all mandatory training and any role-specific modules to promote clinical competence and confidence from the start. So in Ireland, we are monitored by a regulatory body called HICWA, and as that body requires all staff working in the area of social care to have set training. So we would have provided all that training to the individuals when they came over. And then for the PWS services, we would have expanded on that, and we would have done PWS training. And then depending on what location they were going to, we would have also done mental health in PWS training, a wound care management as well, and nutrition training for all of the services. So we developed that training process, that training induction for them when they come into the country. Another little thing that we felt we had to support them with, different countries have different they have different rules around getting a driving license. It's not very easy in Ireland to get a driving license. To be honest, it's not even very easy to get a driving test at the minute. There's a huge waiting list. But what we found was some of the individuals, some of the guys coming over to us from South Africa, the process was you apply for a test and they give you a test. They give you your license. So when we were asking at the interview stage, do you have a full license? They were saying, yes, we have a full license, which they did, but they'd never driven a car. They had applied for the license and were given the license, but didn't actually have the competency to drive a vehicle. So that was something that we learned in the early stages, and then we were able to kind of support with that and find ways to work around that, and driving lessons and opportunities to kind of practice driving. So for some people who had a little bit of experience, the last thing they wanted to do was come into work and drive an 8-person vehicle when, you know, they just weren't ready for that. Ongoing support and wellbeing, then we provided regular check-ins to monitor adjustment and progress, and then all staff in Resilience have access to employee assistance program, which is like a counselling program, a confidential counselling, an online system. So they were all provided with that as well in case they needed any emotional or psychological support. So challenges then that we have overcome, and I suppose just even to say, like, currently I think if I was to put a number on it, we probably have about 60 people have come over to us from South Africa at this stage, and it's quite a new endeavour. It's only up and off the ground in the last 18 months, so it's going extremely well. But challenges that we've overcome, loneliness and isolation, I think is very real, especially if you're up and leaving your whole family to start a new career in a new country. So international and minority staff may feel socially isolated, so it's important for us to foster that inclusive team bonding and peer support, to try and, you know, welcome and just have them completely part of the team and part of the social circle, and organise team nights out or team days out or whatever is needed, just so that they feel part and parcel. And I suppose what we've also tried to do is, when we brought people over, we didn't have just one person in a service. Generally, there would be 3-4 people who would have come over from South Africa in each service at least. So they have somebody who knows something a little bit about home and somebody that they can kind of chat to as well. So it's just that little bit of peer support. Communication barriers, so differences in language fluency, medical terminology or accents can affect clarity. So we did have to provide extra support around language and communication training, just just that extra little piece, and just meeting a little bit more regularly to talk through different bits and pieces and to explain. And like, I myself talk quite fast normally, so it's just being aware to slow down a little bit, and and for them to slow down a little bit, because I won't always understand either. And then especially for our people that we support, that they understand everything, because obviously that's the most important piece. And yeah, so we did quite a bit on communication in general, and we did that with the whole team. We didn't just do that with the guys who came over to us from South Africa. Report writing, we felt needed a little bit of extra input as well, just because if I had to write a report in a language that wasn't my first language, nobody would understand it. There'd be no point in me writing it. But just varied writing styles and standards from different countries. We just had to do that extra little piece around, what the expectation is in terms of report writing within our services and our policies, and just offer clear communication, documentation guidelines, and just that bit of mentorship around that as well. So, encourage them to write the reports and then go back and give feedback on a regular basis, and you can see the improvement happening quite quickly then. The different professional experience, what we found is, in a lot of cases, I suppose in Ireland we're advanced in some ways, not in all ways, but we are quite advanced in some ways in terms of the care we provide. And we're very much, all of our care is provided on an individual basis. It's person-centered, and our social care model is very much around that person living the best version of their lives on that given day that we can possibly help them to navigate. And what we found was a lot of people who were coming over to us came from centres where it wasn't specifically for the elderly, or specifically for people who have mental health, or specifically for people who had an intellectual disability. It was a service that was all-encompassing, that supported all of those individuals and wasn't very person-centred. So it's great. It promotes cross-cultural, intercultural learning as well, because they're coming and they're seeing, well, this is how we do it, and they're able to kind of feed that back home when they go home for visits, and see kind of that individualized approach. So we did a little bit of teaching and training around that, and I've already covered the driving license issues there, so that's fine. And then just the other little bit then as well is, again, recognizing we would have particular annual leave guidance in place for our teams. But if you have somebody coming to you, they're coming from another country, very, very far away, usually we would ask staff to take their leave in 2-week blocks. But for our people who are traveling over, they like to take a month at a time, because they wanted to travel home, they wanted to see family, they wanted it to be worth their while. So we had to be, aware of that. Cultural or religious holidays require an extra time off, and just encouraging that cultural sensitivity and fair leave planning. So that was something we worked on as well. And then I'm nearly finished, I promise. The benefits then that we've seen since we've started this process is we've had the ability to increase the supports and services we offer to people with PWS and their families, which is just the most important thing. Multicultural, diverse teams bringing all their life experiences together to provide a highly skilled, fun, accepting environment for our people. And if I was to accentuate any word in that sentence, it would be fun, because there's lots of fun going on in our services at the moment. The international learning opportunities and sharing of knowledge that I just mentioned as well. Cultural diversity promotes clearer, more mindful communication, because we're thinking about it more. And, oftentimes, people will, like, rather than hold up their hand and say, I don't really know what you're talking about there, they'll sit and say nothing. Whereas now we're very open about communication, very encouraging to put up your hand, stop me if you don't understand, if you need me to rephrase, repeat, and that's going across all of our teams. Active listening and clarification become rooted, improving collaboration. We have exposure to diverse perspectives, so this fosters empathy and emotional intelligence. Diversity brings fresh perspectives and challenges assumptions. Culturally diverse teams adapt more easily to changing environments, which we're constantly changing. It leads to higher job satisfaction and staff retention, and I think that's key. I mean, our staff teams, like, pretty much we're fully staffed in all of our services in PWS at the moment, and I couldn't have said that a year and a half ago, and certainly wouldn't have been able to open new services a year and a half ago based on the shortages of staff that we were experiencing. And then what's next? So I suppose due to the success of this partnership, we are now also looking to branch out into recruitment in Europe. We've been shortlisted for a National Diversity Award here in Ireland, and we hope to continue to develop and expand our PWS services. And I'll just finish off the presentation with a little photograph of two of our teams in our PWS services at the moment. The one on the left was last year at the PWS, the International PWS Day, and the one on the right then was training in one of our local hotels. Thank you.